Network on the WCEG Talk Radio. We are the Worldwide Community Empowerment Group, where we speak life into the community. I am Dr. Dolapo Babalola, physician and owner of Living at Your Finest Wellness, which is a membership-based, holistic and integrative direct primary care practice in Marietta. I am honored today to be your show host in this evening segment on the holistic perspective. We are here to enrich you with information that will inspire you and equally be impactful. So our session today is our season finale for the holistic perspective for the season. Tonight, in observation of the National Women's Health Month, we are going to be talking about women's health. I hope everyone had a wonderful Mother's Day celebration. So the question I have for you today is, are you empowered enough? Do you feel encouraged enough to achieve optimal well-being? So to our women listening, or if you're a man and, the women in your life, that's the question I would like for you to ask them. So my goal this evening is to discuss certain things, the different stages of womanhood, excuse me. And we're also going to talk about age-appropriate screening and laboration, laboratory, labs and health screening. And then I'll answer some commonly asked questions. So please tag a friend, share with your neighbors, stay updated with all the programs. We're live on all social media handles. So please, we even have an app. So yes, make sure you're connected to us at the WCEG Talk Radio Network. All right. So let's get started. Before we do, I will have two quick announcements. First one is information shared on this talk is not intended as medical advice, but instead to provide educational information to support your health and wellness. And two, the views and opinions expressed by the host and guests does not necessarily align with the views and opinions of the WCEG network and management. So now that we've gotten that out of the way, I like to always start with a quote, all right? So the inspirational quote for today is women's health need to be front and center. So our needs need to be front and center. It's often isn't, but it needs to be. So that's our word for today. So I'm going to use my slides. Let me share that quickly. Excuse me, I have a slight dry cough. But let me share my slide and we'll get started. All right, so I'm excited that you are all on today, whether you're watching live or you're watching replay. Today we want to understand women's health, a focus on nutrition and wellness. So as we do that, I want you to look at this next slide. Where are you in this spectrum, right, as a woman? Okay, so we have birth, we have adolescent, we have pre-menopause, we have perimenopause, and we have menopause. So women are so blessed to go through several stages. Men, they only have one stage, that's the puberty, and that's it, really. But women, I just see it as a blessing that the Lord has ordained us to go through several stages. There is, not to get all spiritual, but they say God will not give us more than what we can handle, right? So it must mean that God, as women, he knew that we could handle all these different stages in life. So it's important for us to be well equipped and knowledgeable about all these stages. So certainly for adolescents, I'm going to share what health screenings are important. I'm going to really dive into what these different stages of health, what it entails. So 3 stages of menstruation, hence the word menopause, period pauses. So after birth, when you become adolescent, right, you have, the eggs and the ovaries, they're maturing, but it doesn't come without a signal from the brain. And so that signal from the brain is called the FSH, follicle stimulating hormone, and the LH, which is the luteinizing hormone. They all start from the brain. So as adolescents, you understand that there's some maturity that is taking place. So you begin to speak to the ovaries that, okay, we need to produce, we need to reproduce, right? We need to produce an egg. So that's where we have the estrogen. The estrogen is what you see here build up. So the estrogen is the light blue. After the LH and FSH is kicked in, then the estrogen picks up, and there about day 14, the egg is ripe enough and it's released, right? So when it's released, the idea is your progesterone, which is here, is supposed to maintain the fertilized ovary. But if it's not fertilized, then that's where you see the tears. That's the cycle that we see. So it's a series of hormones that take place that bring about the stages that we see in women. Now that we've talked about that, let's talk about health screening by age. It's very important that we all stay healthy, we all stay up to date with health screenings. Health screenings are preventable. It really helps to screen for diseases, to make sure that if there's any early disease, we can catch it and take care of it right away. So starting with ages 18 to 39, certainly cervical cancer. The guidelines have actually changed. It used to be that we'll start pap smears at 18, but we actually start at 21. So ladies, if you haven't had your pap smear, whether you're sexually active or not, you need to get a pap smear. Okay, so pap smear every 3 years. And then once you turn 31, once you turn 30, then it's every 5 years. You also want to check your cholesterol, especially if you're on the overweight side or if there's a family history of diabetes. Flu shot, wellness visit. I've heard patients tell me, I don't go to the doctor. I haven't had a physical in a while because I feel good. There's no need to go. But that's not correct. You do need to go and get checked at least once a year. All right. Now, age 40 to 65, there's a lot that is going on. Certainly, we want to check our blood pressure. If you're not going to the doctor at least once a year, that means you're not even checking your blood pressure, and that's not good. Blood pressure is a silent killer. I've had a patient that didn't know they had blood pressure until they had a stroke at 38, pretty young, yes. And that was because blood pressure left undiagnosed. All right, cervical cancer, you continue, and this is actually every 5 years now at this point, because you are in your 30 to 65, you get that every 5 years. Cholesterol, and then colonoscopies have actually changed. It used to be 50, but now it's at 45. So you check that. Same thing with mammogram. You have to check mammogram at least, baseline at 40. Some different organizations have different things. Some people, the CDC, as well as the United States Task Force, says, you start at 50. It really depends on, you would have to have the individualized conversation with your primary care doctor. All right. So again, your wellness visit, do not skip your wellness visit. If you have not had it, please make sure you go. It's a birthday gift to yourself. Go for your wellness visit, okay? Shingles usually starts at 50. Some people get it at 60, but ideally you should get it at 50. Okay, 65. I always say a birthday gift at 65 is your pneumonia vaccines. You get a DEXA scan. It's not on this list, but the DEXA scan checking for your bone integrity, make sure that it's not thinning. Again, the blood pressure, your cervix, you got to get that checked. Cervical cancer, you actually stop at 65, so you're not getting it afterwards, okay? So you stop at 65. Colonoscopies, you continue till you turn 70, okay? 75, I believe, yeah. And so these are the screening that you need to ask your doctor about. Please make sure that you're up to date with all your health screening. Okay, so now let's talk about the stages of menopause. So we talked about birth, what happens with birth, and we know what happens at adolescence, right? The cycles start, I talked about that, and then we talked about the screening. But now we're going to talk about the stages of menopause. The different stages of menopause, we have peri, that means around menopause, and that's usually between 45 and 55, with an average age of 51 achieving menopause, 51, 52. And then the interesting thing is that some people start as early as 10 years. 10 years before your cycle finally says it's done. Some people start really early. And those symptoms could be really hard. And so what's happening around perimenopause is a roller coaster ride. It's like zoom, zoom all over the place. You can never really predict what's going on with the different hormones that I spoke about. Now, menopause on its own, though, that just means 12 months, no menses, no cycles. Your ovaries have stopped ovulating. They've pretty much fried up, no longer working. And so you see the decline in the estrogen, it's declining, your progesterone is declining, testosterone is declining, and then post-menopause, it's pretty much leveled out, all right? So that's the different stages. So now that I've given you the different categories, I want you to kind of, pause and ask yourself, where are you? Are you pre-menopause, before menopause, still experiencing regular periods? Or are you peri, changes in your periods? You have not gone 12 months in a row without a period? Or are you postmenopausal, meaning after menopause? So kind of take notes of where you are. All right, and then I want to define some terminologies. I think it's important for us to understand this. So natural menopause is just that on its own, it's already designed in your DNA when you're going to stop cycling. So it's nothing that you did or did not do. Now, there are some people that have done something to absolutely stop it. So that's surgical menopause, the removal of both ovaries. That is surgical menopause, okay? But natural menopause is you just don't have menopause. You don't just cycle anymore. So you have an elevated FSH greater than 35 and you have a low estradiol. So estradiol is the estrogen that helps to build the ovaries, okay? Early menopause is if you're younger than 45. Premature menopause is if you're younger than 40. And then perimenopause is what I talked about. Now, there are two different stages of menopause, of the perimenopause. The early is that your cycles are more frequent. I had a patient tell me the other day, I just had a cycle. What's up? Why am I bleeding and why am I spotting again? She really couldn't tell what exactly is going on. And that's because your progesterone is just like, that's the one that really holds the uterus. It's really dimming, it's declining. So your cycles are closer. And then as you get into late menopause, your estrogen is definitely very volatile. So it's not building the uterus as it used to. So your periods are farther away. So just based on symptoms, you can tell what part of menopause you're in. Okay, so why are we talking about this? It is important for women, especially this month, for us to be aware of what is going on. We don't want to just sit back and say, oh, it's life, it's what's going to happen. We need to be empowered about our health, all right? Because we are all going to go through it, whether we all have the same symptoms or not, we are going to feel it one way or the other. And unfortunately, it has become under-recognized, undertreated, and mistreated and misdiagnosed. But the good news is that you have all been, unless you're living under a rock, the men probably have heard it too much already, menopause. Menopause, mothers never talked enough about it, but the times have changed. We're all talking about it now. And it's important, rightfully so, all right? It has been shown that women of color unfortunately experience it more and even much earlier, all right? I know of people that have decided they want to stop working, just retire early because they can't figure it out. Doctors are dismissing them. They really don't know what's going on. They're tired, they're drained. So yeah, it's affecting the workforce. So we definitely have to be empowered to ask questions and find a doctor that is versed in these, treatment of women and especially in the midlife cycle. Okay, so let's talk about our hormones. I don't know how many of you watched the Charlie Angels. This was one of my favorite shows. I always wanted to be a Charlie Angel. If I didn't study medicine, maybe that's what I would have done. But in any case, it's so important for us to be aware of the three main hormones. We have our estrogen, which regulates our menstruation. Of course, estrogen has partners as well, like the progesterone, which helps with our mood, as well as the testosterone, which helps with muscle preservation. And then we have our thyroid, which affects our energy and our metabolism. And then we have our cortisol, which its main focus is stress hormone, regulates blood pressure, regulates our immune system and blood glucose. So it's important to know that. Now, the reason why I have this slide here is because I think it's important for us to know what the different hormones actually do in our body so that you understand when you're having symptoms, where is it coming from? Like, for instance, I am in early menopause, that transition, perimenopause, early perimenopause. So things that I'm experiencing, like sometimes the brain fog happening because we have estrogen receptors in all parts of our bodies. And so if we don't have the metabolization of glucose in the brain, it can cause brain fog. So some of the things you see with estrogen, impaired blood glucose, insulin, there's some people that are exercise very well and all of a sudden the A1C is going up. It's because of the estrogen effect. There's a lot of symptoms that come along with progesterone as well. Progesterone is the one that makes us calm. If you don't have that, then you can imagine all the things that you begin to feel. And then the testosterone hormone, what does it really do? Main things, it supports our health. It helps with muscle development. It helps with our mood, sex drive, red blood cell production. So a lot of great things that these hormones do. So this is what it looks. The tank is empty. So when we are in perimenopause, it looks like the tank is completely empty. It's dry. And it's dry because the eggs are saying, we're done here. I think our lifespan is over. We are not producing estrogen and progesterone and testosterone, and they're not listening to the brain hormones anymore. So the good news is that there's solutions and there are things that we can do to mitigate that. Now, this picture kind of gives you a sense of what's really happening in our body, the iceberg. So you see what's going on at the bottom, and then how it manifests on the top. So I talked about the brain fog. Some people have what we call hot and dry. So hot is hot flashes, night sweats, because of the thermostat that is altered. Because again, we have estrogen receptors in all parts of our bodies, so that is affected. There's suddenly a lot of weight gain because of insulin resistance, because of cortisol increase, and it helps to deposit fat in the midsection. And then there's a lot of dryness. So it's a lot of things that you notice, people having urinary tract infection, lots of symptoms that happen because those three main hormones are not working as well. This slide just shares the different receptors that we have, the estrogen receptors, over 400 estrogen receptors. So estrogen is a good hormone. It really is a busy, good hormone. It takes care of so many things in our body. So I give it my respect. Now, I want to take a few minutes and talk about what we call genital urinary syndrome of menopause. This is something we don't talk enough about because, number one, in the clinic, it's your doctor is very fast, 10 minutes. You don't have enough time to talk about this, so you think it's not important, so you don't bring it up. You feel some kind of shame. But we shouldn't be ashamed about this. This is just natural physiology. But it doesn't mean that we should hurt. We should suffer in pain. So this is important that we have this conversation with our doctors. I had a patient just the other day having urinary tract 1, 2. Okay, what's going on? Then, finally asked her. I'm like, okay, because I had asked her before, what's going on down there? People don't check. People are too busy. She said, okay, yeah. Anytime she's intimate with her husband, she always ends up with a urinary tract infection. And it's not her fault. It's just because the vaginal wall, it's kind of like atrophied, so it's dry, it's not well lubricated, and it does increase the risk for urinary tract infection. So you see the picture on the right side, you see how lubricated and how beautiful it looks, and then on the other side, the left side, you see how thin it looks. All right, so these are some of the symptoms that people experience: dryness, decreased lubrication, even postcoital bleeding is definitely one. And this is just a picture that shows you how dry the vagina area is. So it's so important. Please, as you're listening to me, if you're experiencing anything like this, I know these pictures could look a little bit gross, but please talk to your doctor. Talk to your doctor if they can help you. The menopause page just look for a provider in your area. I am in Marietta, Georgia, and I care about my women, and I've done additional training just to know how to appropriately treat my women, because no one should be suffering in pain. All right, now let's talk about women, just exactly what happens to women as we age. The estrogen is a powerful hormone, and it does multiple things. It actually protects us from cardiovascular conditions. That's why for women, we don't have high risk of heart attacks until we lose that estrogen protection. Estrogen is a vasodilator, and what that means is that it dilates our vessels, so blood flows freely. Now, when we lose that, then we have all these complications that come about, and we need to be very mindful. And if we know better, we do better. All right, these are some of the chronic diseases that increases after menopause: cardiovascular disease, like I already said, breast cancer, hypertension because of the cortisol increase. It constricts the vessels. Type 2 diabetes because of the insulin resistance that becomes, at war with the absence of estrogen. And the Alzheimer's disease, which is also known as diabetes of the brain, and osteoporosis is the thinning of the bone due to the lack of estrogen. All right, this is an example. This is a picture of the brain. So for a minute, I want you to look and see, what do you notice? You see the difference with premenopause? You see how it's lit up? You see how the blood supply? Compared to peri, it's becoming dimmer. And then post, there's no light anymore. It's not as bright. So this is what we have to deal with. And so that means we need to take charge and make sure that we don't fall into statistics where, because of menopause, we cannot live a healthy, long life. All right, so let's talk about weight gain. This is a commonly asked question. What leads to weight gain? I'm doing the same thing and everything is just changing. Several reasons. Certainly loss of muscle mass. As we age, especially after 30, we lose muscle mass. And even after menopause, even worse. So 3 to 8% of body mass loss. And then they sleep disturbances because our progesterone, which keeps us calm and relaxed, it's decreased. And then there's all that anxiety, again, attributed to the progesterone, and then insulin resistance, like I already shared. All right, so a little bit more about what we see with hormone shift. So estrogen, progesterone, and testosterone, and then the hormones of the brain. So a lot of times, patients do want to get blood work, but the best diagnosis of perimenopause is your symptoms, where you are, where your cycle is. Labs, depending on what's going on, could determine if we really need labs to support a diagnosis. But when we do a comprehensive intake, that's where we decide, okay, which stage are you? What can we do to help? But I just wanted to mention some of these hormones, which we talked about earlier on. The one in particular that I want to emphasize is ghrelin and leptin, and that is the one that controls hunger. Either you feel too hungry or you don't feel full enough. All right. Okay, so lots of muscle I already shared that we lose muscle. You see the difference at 25, your muscle, you're bulky, and at 65, it's less muscle mass. So that's why you will see some of the solutions. So we've talked a lot about the problems. Let's talk about the solutions. What can we do? Yes. So I want to start by saying small steps, big changes. So don't go from 0 to 100. Take those baby steps to get to where you want to go. So when it comes to women's health and women empowerment, we need to all remember, because of the different stages that we go through, that we need to always have this lifestyle redesign. We can lean on our botanicals and also bioidenticals if you're open to that. You certainly want to start with baseline labs. Always make sure, yes, you get your age-appropriate screen, but you want to get labs. Labs, you're checking your CBC. Some people might need to get iron studies as well, just to make sure that they're not anemic, make sure that they're not iron deficient. You also want to check your kidney levels. You want to check your lipids, your cholesterol, A1C, your thyroid, evaluating thyroid because it controls energy and metabolism. And then vitamin D, because it could cause fatigue. Okay, So these are some of the hormone labs. If we are going to do them, it's personalized, it's specific to if it's required. Okay, this is also another measure where we check your waist to your hip ratio just to get a sense of, is there high cortisol? Is there a lot of visceral fat going on? It's a really quick and dirty way to gauge. All right. Now, this is an in-body scan that I do have at my practice that I always encourage women to get, and not just rely on what your weight is on the scale. The weight on the scale does not tell you anything other than the weight on the scale. It doesn't tell you what your muscle mass is. It doesn't tell you what your body fat is, your total body water. All of this is what gives you a guide to your health. So if you haven't had one, please make sure that you get one. Okay, so continue with our treatment plan for perimenopause, midlife transition. We have to optimize our nutrition. We cannot do business as usual. Just eat what we like, whenever we eat it, whenever we want. We have to own on our nutrition, physical movement, behavioral modification, which includes stress management and sleep and other things. And then, of course, if weight loss medication is an indication, then that's where we will go. All right, so this just summarizes everything that I just shared. We want to eat the rainbow, all right? We want to focus on fiber-rich foods, high protein and minimally processed foods, and our added sugar needs to be 25 grams or less, okay? You want to monitor your caffeine intake. Physical activity, we want to do a combination of stretching, we want to do cardio, and we want to do strength training to maintain the muscle mass. And we certainly want to, apply the stress reduction, journaling, meditating. All these things are so important. Sleep is so important. They say if we don't snooze, if we don't snooze, we don't lose. All right, social connections we have to draw from each other. Women need to support each other. We need to come and help each other and talk through these things. And certainly reducing alcohol matters. So this is a picture of what your food should look like. All right, so this is what it should look like. Very colorful, very beautiful. Oh, yes. Look at that. Beautiful, beautiful. And then this is just everything that I shared already. And then we need to kind of decrease what we call the SAD diet, SAD, which is standard American diet. These are the things that are in the standard American diet: red meat, refined grains, processed foods, high-fat dairy products, desserts. All these things, we have to cut back on them because they're estrogen disruptors. It just causes a lot of inflammation and more weight gain. So we have to be very careful. Now, let's move on to the second aspect of how we can manage midlife transition. So the kind of supplements that we use matters. We want to do a lot of B complex, magnesium. Some people that have a lot of hot flashes may benefit from the black cohosh. There are other supplements that are very helpful. So you want to talk to your provider, your physician, on what will be the best option for you. Now let's talk about hormone replacement therapy. I don't know if this is one that you've heard about or you have questions about, but it's been in the news a lot, and rightfully so, because we need this. We need to feel like ourselves again. If our estrogen is tanking, our progesterone is tanking, there needs to be a way to build those levels to a reasonable place where we can feel okay. And so these are the 5 main benefits of the FDA-approved hormone replacement therapy. One is certainly to alleviate hot flashes and night sweats, to improve on sleep so that we can sleep better, certainly support weight management with a healthy weight, and then enhance mental clarity. And the last one is cardiovascular risk, osteoporosis. These are all indications for hormone replacement. Now, I do want to say a few words, even though, yes, you do see here, a lot of people hear hormone replacement and they're thinking, oh, it's going to cause cancer, because that was what was in the media. But there are 2 different types of hormones. It's not the same. So two different types of hormones, not the same. We need to be very mindful of that. And I'll share this next slide. The Women's Health Initiative. This was a project that was done in the late 90s, 2000s, and it really caused a lot of problem because patients were placed on synthetic hormones, estrogen and progesterone, and they did find that a few of them increased their risk of breast cancer. But the hormone replacement therapy is different. It's not the same. What I'm talking about with the bioidenticals, these are natural physiological hormones, not the synthetic. Two different things. All right. So I wanted to just pause and say that. Now, that clearly there's some red lights for women that should not be on hormone replacement. Certainly, it'll be people that have had a stroke before, people that have had breast cancer, but the estrogen receptor positive. Not everybody that has breast cancer is due to estrogen receptor positive. All right, unexplained vaginal bleeding and recent MI, these are reasons why you cannot be on a hormone replacement therapy. Now, let's talk in the next few slides, what form of treatment are available. So if we were taking care of estrogen, which is the big house, right? The estrogen is what gives us the collagen, gives us the vibrancy, gives us the lubrication, helps with the thermostat, a lot of great things, energy. So this can be treated through the pills, and certainly creams, rings, gels, several treatment options. And then the progesterone, that could be in a form of device, an IUD. It could also be in a form of a pill, suppositories, and creams and patches. And then testosterone. Now, I do not recommend pellets. I know a lot of people do pellets out there, but I do not, because it's not FDA approved. It gives you a boost of hormones into the body. So it's not the best option at all. The ones that I prescribe at my practice and has helped my patients significantly is certainly oral. I've done the cream and the intramuscular. So those are options that are well approved. And then for some women that don't want to do the estrogen, you can have like a lubricant or moisturizer to prevent having dryness in the vagina area. So there are options. Okay. Now the medications, if after everything that we talked about, there is an indication for weight loss medication, we just have to make sure that it's in the right class. All right, so BMI greater than 30, a BMI greater than 27. So those are the different indications. If it's BMI greater than 30, there's no comorbid problems, but if it's 20, there needs to be some comorbid issues. All right, so back again to this picture that we talked about, the iceberg. So the question is, if you're listening, are you experiencing any of these? Is this something that you're quietly keeping at bay and you're not discussing it? I think it's time that you bring the conversation, because it's all part of women health. It's all part about being empowered. So today I've done my best. It's a lot, and I don't want you to feel overwhelmed, but it's just to kind of get you in the thinking that there are options and there are things that you can do about it. I want you to know that it's not a one-size-fits-all experience. Some people have hot flashes, some people don't. Does not mean that you're not experiencing one way or the other of the ovaries situation. It's just that yours is different. So you want to be informed, you want to stay informed, and you want to keep track of your symptoms, right? So what are the symptoms you're having? I know what mine are, and I've been able to tackle each of them, right? You want to be able to advocate for yourself, and you want to get resources. I have some resources that I placed over here that you might find helpful. There's several podcasts out there that talk about midlife, that talks about menopause, perimenopause. There are great books out there, and there's a whole menopause society. I'm a member of the society, certified in menopause treatment. So certainly you can find healthcare providers that will help you take care of what you're going through and make you feel like yourself again. All right. So these are some of the books. The ones that people talk a lot about is Estrogen Matters. There's also the Vagina Bible. There's a lot of great work out there that people have done. So for our women, please feel empowered. Don't sit quietly, just letting it happen to you. You have to take charge of your health. So lots of great information that I've shared today. I'm going to take a few minutes and just talk about commonly asked questions, okay? And I would love, if there are any questions out there, I would love to answer them. But yeah, so a question that comes to mind is, how soon can you start hormone replacement therapy? Do you have to wait till you're absolutely no longer seeing your cycle, like menopause stage? And the answer is no. You can start as soon as you're having the symptoms. Again, it's symptoms driven. If you're having brain fog, if you're having hot flashes and night sweats and you can't sleep, and they've taken a comprehensive intake and it sounds like you're perimenopause, then yes, you can start treatment right away. Certainly, the lifestyle redesign is a good place to start, but hormone replacement therapy has been shown not only to decrease, the osteoporosis, but Alzheimer's risk. There's a lot of benefits. So you can start as early as you need to start. Another question that comes up is, well, I've already been menopausal 10 years. I've heard or read somewhere that after a certain period, it's too late. Well, it's never too late. The studies do say about 10 years, but I do have a lady who's suffered with hot flashes for over 10 years. And she's doing well now and she's fine. She gets her screening, she's doing well. So that is an individualized conversation with your healthcare provider, but it's never too late to start on something. Okay. Another question that comes up is, well, how do I know if I was on birth control? What do I do? Can I continue? Do I switch? So the answer to that, again, is personalized and individualized, but we find out that the average age of 55 is when people have hit menopause, and there's no need to keep taking birth control pills at that point. So you can actually sooner, if you like, to get off the birth control because that's synthetic estrogen and progesterone and get hormone replacement, which is a lower dose, but it works efficiently enough to get you at a level for you to feel good and feel like yourself again. All right. And then the last question that comes up, that, I'm doing everything possible, but I just can't sleep and I'm having a lot of anxiety and I find that I'm gaining weight. Well, that could certainly be due to the progesterone. The lack of progesterone will certainly increase your anxiety. And so what does progesterone do? If you remember the cycle that I showed you, progesterone peaks after the egg has ovulated, after it's been released. And what the goal of progesterone is to protect the egg and surround the egg till it's implanted in the uterus. So it gives you that calming effect, that soothing effect. And so when we begin to lose our progesterone, we can get anxious. I know I've experienced that. And I'm not generally an anxious person, but just having palpitations and nervousness, that's because of the progesterone. So certainly making sure that lifestyle, you might need to up your meditation, you might need to up your breath work, your sleep, you want to help with your sleep hygiene. But if you need other things, you certainly can tap into those things for sure. All right, so those are some of my commonly asked questions. I hope that today has been helpful. I hope that it's been enriching for you and you've learned a lot about women's health. It is important that we take our place in the community and stand strong and don't let anybody dismiss us. All right, so let me end with this quote. I think it's very appropriate. At the end of the day, your health is your responsibility. It's my responsibility. It's your responsibility. Nobody's going to do it for us. I mean, certainly you need your doctors that can help you and guide you, but you need to find the right one. So this quote is by Julian Michaels. So at the end of the day, our health is our responsibility. So I hope that you all have a marvelous summer. We will be back again sometime August, September for the holistic perspective on the WCEG radio network. So take care and God bless.